Assalamu alaikum. Good morning. I'm Dr. Christiana. I have worked in Qatar for about almost 5 years with Al-Wabra Wildlife Preservation before I started working in Dubai at a private farm. And I will tell you today about Scoop the Poop, or the importance of routine fecal examinations in falcons. So, to do a fecal exam can give you a snapshot and a good indication of the health of a bird. It's a very non-invasive and not stressful exam and can be done easy, quickly, and it's very cheap. And partially it can be already done by the falconer because the first part that you do is the macroscopic examination. And actually, I should not call it fecal exam, I should call it dropping exam, because I think that there's not enough focus on the whole dropping itself. So when, where, and what to do? When the best place, and that's the part that can be already done by the falconer, is early in the morning when you go to the place where the bird is perched, and you can see the bird itself, you can see the droppings, and in addition, you can see the bird produce rubaya, the pellet, and how many droppings did the bird have. Coming or not? Oh, okay. So, a normal dropping of a bird consists of 3 parts, and they're all collected in the cloaca and then voided as a dropping. One part, here's the mouse, is the fecal part. That is the waste from the digestive system, and it should be dark and solid. Of course, the color can depend a little bit on what you're feeding the bird. Then we have the urids. That's the result of the bird's protein metabolism, and it should be white, can be off-white, and opaque and thick. And the urine part, it's the clear part, the waste from the kidneys and the excessive water, and that should be always clear. So every dropping should have these 3 parts. Sometimes, of course, if you don't feed so much, the fecal part can be missing. So you should always have a look at the macroscopic examination. How's the volume, the size, how's the consistency, how is the color, and how frequent do the droppings come. This picture shows you a normal dropping, and you can still see here where the urine part was, the watery part that is soaked up by the sand, the white part, the urids, and the normal solid fecal part, dark. And now on the next slides, I will show you a few examples how fecal shouldn't, or how the dropping of a bird should not look like. So on the left, that bird has flown away. It's a gyr, and was flying for about 3 to 4 hours. And finally, they caught it, and it was very nervous. Started jumping in the car, and then brought to us. And the first excretion it had was very bad smelling, and red, bloody, and we were not even sure, does this come from the kidney or is it actually from the digestive tract? Then we can have lots of people come to us and say, my bird has green fecal. Yeah, what does this mean? Is it only the fecal part, or is it actually the urids that are green? This is very important. So in the upper picture, you can see the urids actually look normal. They are bright white, and the small brown parts, they are fibrin, and the bird was probably not eating a lot, so that's why the fecal part is very greenish. And in the lower picture, it's the urids that are green, and the fecal part actually looks normal, and that's a good indicator that something is not okay with the liver. Then here, of course, you can find worms in the fecal. On the right side, low, ascarids. It's very easy to see. And on the upper picture, you can see that this is what we call diarrhea. So the white part is actually normal, and then you can see the normal urine part, this clear fluid, and the fecal part is not solid, it's very watery. So this time it's coming from the digestive system. And the left picture shows there's blood in the dropping, and you can see the blood is connected to the solid part. So, and the white urites and the urine is normal. So it's very likely that this one is coming from the digestive system. And when you have evaluated them, had a look at the macroscopic part of the dropping, then you can go over, and this is mostly done in the clinics, to the microscopic examination. For that, you need a microscope. Usually we do 100 to 400 times magnification, and you can do a native smear or flotation. And a native, we usually take a small piece of the fecal part, and we mix it with normal saline, and then cover it with a cover slide, screen it with 100 times magnification, and then 400 times. And I will go quickly, very briefly, through a few things that you can find. One thing, of course, the parasites. Several parasites. In this one you see, I think you call it Dudforsa, the Capillaria, then Dudkepta, which is like flukes, and of course, what they call it Coccidia, it's Cariospora, and it's very important that you always not only see it. One egg might be normal, but if you have more ovaries seen, then maybe you have to treat the bird. The same goes for bacteria. You can see bacteria, and I want to point that out because lots of people come to us and say, oh, my bird has bacteria. The doctor says the bacteria is in the fecal. This is normal. There must be bacteria. The point is, which kind of bacteria? Is there bacteria of one sort that is higher, increased, and too much? Or is it just the normal flora that you are seeing under the microscope? This picture you can see Clostridium. One maybe not a big problem, but if you stain it and you find, I don't have a pointer in the mouse, but you can see the colored ones, not the fully colored blue, what in the middle where there's a little pinkish, the Clostridium spore. So if you find a lot, that's a problem for the bird. You also can find fungus. If you give for example, a lot of antibiotics, sometimes you find Candida. So this is something to consider. And then if you have done all this, you can go and if everything is okay, maybe you don't need to have further diagnostics, but if you, for example, find that the urites are green, then you have to find out where is it coming from, why. There's so many reasons behind that. So you can start doing blood examination, checking the hematology and the biochemistry, going for further bacteriology or virology, does the bird have maybe avian influenza? Or you can check, is there any link to aspergillosis? And you do endoscopy and x-ray. So there can be so many reasons behind when the fecal is changed that you have to maybe do further examinations. This was just a short introduction and about things that you should keep in mind. And I want to present you one case that had changed droppings that we were dealing with in the last weeks. The case was this: 12 birds in one chamber. They were all looking okay, flying well, and suddenly, when we were feeding them, only 3 birds came for eating. They all still looked normal, and this is what we saw. We saw very green droppings. And the question was, of course, 12 birds in the chamber, 9 didn't come to eat. Is it all 9? Is it only 1 that is sick? So we decided to catch them, put them on perches and blocks, and see which bird is actually affected. And you can see, it's not so clear on the picture, but there's a lot of green urids around the block. And within 24 hours, we had 3 birds dead. So now I would like to know what would have been your differential diagnostics. Anyone, some suggestions? Nothing? Bacteria? Okay. What else? What else?
We need mics. Mics. Can you show up your hands, please?
No other suggestions? Newcastle? Okay. Was not so high on my list, but okay. Nothing else? Only 2 differentials? Jafaf? Okay, yeah. For sure that was there, 100%. Okay, I tell you what we did. Oh, sorry. So we caught all the birds, and we took, first of all, we took tracheal swabs to test for avian influenza with a snap test. That turned out to be negative. We collected fecal, and we took cloacal swabs. The fecal samples, I mean, there was maybe a little bit more bacteria, but nothing abnormal. And of course, I unfortunately don't have the pictures here on this computer, but we opened the 3 dead birds, of course, because it was very likely that they have the same as the still live ones. And we did cytology when we opened it in pathology, we found very big liver, hepatomegaly and splenomegaly, and we took cytology and we found that there was a lot of bacteria, lots of intracellular and already phagicized bacteria, and they were all gram-negative. So this was our quickest, what we could do directly on site. Of course, the swab we had to send away for culturing because we don't have too much of diagnostic possibilities in our lab. And we started all the birds directly on antibiotics, just to cover any secondary infections, and we started on a broad spectrum antibiotic. We gave sulfonamides and trimethoprim sulfonamide, and that's what came back, Salmonella. And now the big question was, how do so many birds, from one day they were fine, get Salmonella, and a few of them in this hangar, they were compromised, immunocompromised maybe, but 2 or 3 with an old Asper infection, but the rest, they were absolutely healthy birds before. So we thought, what is the most likely thing? And they were all fed on locally sourced frozen quail. And so we thought, of course, the food source is the most likely reason where the birds can get the Salmonella from, like in humans. And we also took swabs from our frozen quails. The frozen quail that we were feeding is, you see on the right side of the picture. It's actually for human consumption. And we found out it's very, very bad quality, and it's full of Salmonella. And so, of course, the next step, directly change the food source. So now we are getting a different food source, much better quails. You can see the difference on the left side. There's still a lot of blood inside. And really, it's very good quality. And we sent samples to Europe for Salmonella typization. We have already back the result from the Falcons, and it's Salmonella typhimurium. But we are still waiting for the result from the quail. We didn't get that yet. So just to share a quick case that can change the droppings of a bird, and you have to be very careful and investigate where it can come from. I want to thank my colleagues and Dr. Amrita and Dr. Angel and the CVL, that's the Central Veterinary Research Laboratory in Dubai, that helped us and were very quick trying to find out what has happened. And thank you for your attention.